Congressman Herger, for coming today.
Let me just state on my voting record, I've been in office a number of years. I think my voting record is very consistent. I think it isn't much of a surprise how we are. So I want to thank at least the majority of you who support me here. I know we have many of you guys. The majority who do support me, I want to thank you. It's a privilege. But we have many good, honest, hardworking Americans who see it a different way. And that's the greatness of our society. And working together, we all want a better America. I believe we all agree on that. And so we'll keep working together.
Once again, Congressman Herger, thank you for being here. I do want to point out to people who are not really close, that chart was prepared by the Republican staff of the committee. That's not a nonpartisan. Very small print, but if you get up close, you can see it. I've heard a lot of people say they don't trust the government. Government's the problem. And from my point of view, the problem is an insurance industry that has no competition, particularly from a public option. When my stepfather needed heart bypass surgery, Medicare paid for it, and he was delighted with the coverage he got. When my mother had Parkinson's, she received coverage from Medicare, was delighted with the coverage she got. When my daughter passed out, and I took her to Enloe Prompt Care, and they said, you need to take her to the emergency room now, and we did, my insurance company, Blue Cross, denied it because it was an emergency room visit. And when I called and I said, what's going on here, that told her to go, they said, well, we deny every claim for emergency rooms unless the person's admitted to the hospital. That's what's wrong with the system, is there is no competition for the private health care industry. And the fact that insurance companies give a lot of money, members of Congress, including $85,000 to you, according to the Sacramento Bee, I think is part of the problem. And I think we need to look at this objectively and find a real competition and a public option against the insurance industry monopoly.
I'm one of the biggest supporters you ever find in competition. I believe that's why our nation is the great nation it is. But I'd like to ask anyone here to tell me, how can you have a government who doesn't have to turn a profit, they can lose money every year, they can print money, they can decide, they're the umpire and the referee all at the same time, they decide what they're going to pay you. How can you, a private entity, ever compete against that? How anyone with a straight face can say somehow the federal government, who runs all their programs so well and so efficiently, is somehow going to be efficient in this area is beyond me.
Mr. Herger, welcome to Chico. I have a sister who is living in France. She's a French-American citizen. She has Parkinson's disease. She's getting excellent care there. And she doesn't need to come to the United States to get better care. She can stay there and do just well. But beyond that, he sort of stole my thunder because I'm curious about the insurance industries and the pharmaceuticals and your viewpoint on health care. Since you do take 85.7 from insurance companies and 32 from pharmaceuticals, how can we be sure that we're really getting your full attention for some other possibility?
Well, again, my voting record, I believe, is very consistent, one. Number two, everything that any of us in elective office receive is public record. You can turn on your computer and find what any of us get. And let me just mention this. You know, they like to bring up what I get from this group or that group. It's interesting. Nancy Pelosi gets far more from insurance companies than I do, and so does the president. The fact is, I'm not supporting the insurance companies. I'm saying they need more competition. I think there needs to be more of them. There need to be more groups that can come in and compete with them to drive their costs down.
I've been very concerned by the healthcare debate, such as it is. There there's a tremendous amount of misinformation and half information being floated out there. You have indicated that there are thousands of people from Canada coming to the United States because they can't get so-called decent care up there. And while it may indeed be true that some people, particularly who are looking at elective procedures, may decide to come to the United States in order to speed things up, and they have the money to do it, well, that's great for them. But you don't seem to recognize that there are tens of thousands of people also leaving the United States, going to India, going to Mexico, and to other areas that are setting up medical facilities specifically to help us because we can't get affordable health care here in this country. We are taking selected individuals who have an axe to grind to bash the national health care systems of other countries, which they all admit they're not perfect. God knows our system isn't perfect. However, when right now the people in the UK are pretty pissed off because we are trashing what they consider a national treasure, their national health system. Both parties, both political parties have backed away from the few representatives who have been, waved in front of the American people as supposedly representative of this terrible evil that has been foisted upon the people of the UK. And it's simply not true.
Okay, we'll put you down as the supporter of the government plan. Over here.
Thank you.
Representative Herger, thanks for your time today. I wanted to describe a problem, make a suggestion of what I think, and then see what you think. The issue that I've heard a lot of people address is bureaucrats getting between our families and the doctors. My family's recent experience is my two young 20-year-old children have both been denied health insurance because of pre-existing conditions. In both cases, they had things that had happened many years in the past, and the health insurance companies are saying that they have to be 10 years symptom-free before they can buy health insurance. We suggested, well, let us just buy catastrophic insurance with really high deductibles. Both of my children have been denied insurance. My suggestion for a solution is that the current Medicare program doesn't deny people health insurance because of pre-existing conditions. Once you meet the age requirement, you're eligible for Medicare. Why don't we reduce the age requirement to birth and allow all Americans access to health?
Well, we have to get something, and I believe we can, and I believe that proposals out there that would address the very serious problem we have with pre-existing health problems.